Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, my incredible and knowledgeable nurse practitioner, Rosalind Arp, and I share our combined 30 years experience to guide both men and women as they age. Listen as we dive into a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. These real-life insights are always rooted in solid scientific knowledge. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Welcome back. Today we're tackling understanding the topic of vaginal rejuvenation, what it really means, and who might need it.
And why does Dr. Jackson does not like that term?
Yes, let's find out why. But the first thing I really want people to know is that vaginal rejuvenation is not a specific medical term. It was made up by the mainstream media, just like the term mommy makeover. There's no one procedure that describes vaginal rejuvenation, and no one type of person who may need it. In fact, I actually prefer the term vaginal restoration. That's really what our goal should be. Vaginal rejuvenation can encompass a whole host of restorative procedures for the vagina, the vulva, and the pelvic floor. What I also don't like is the connotation that normal changes that occur to the vagina with childbirth or with aging are somehow ugly or unhealthy. So let's take a look at what can be the changes that occur to this area over time. Or we'll subtitle this podcast, What Your Mama Never Told You Can Happen to Your Vajayjay.
Right. So there are several changes to the vagina and the vulva as we age. Pregnancy and delivery probably creates the most dramatic changes. Carrying a baby can cause weakness in the pelvic floor muscles. And of course, that partly depends on how big or heavy your babies were. Labor and vaginal delivery can create tears in the fascia. That is a strong support tissue that holds up our organs. As we age, any tears in the fascia can widen or worsen. Plus, we can make the tears worse by doing things like chronic straining with constipation or repetitive heavy lifting and carrying excess body weight. And to add to that, the loss of hormones as we age, and this can also lead to the worsening of the situation.
I always liken damage to our fascial layer to a tear or a run that you get in your stockings. If you get a little tear in the stocking, but you don't tug or pull on the stocking too much, it may stay that way, just as a little tear. But if you start pulling and tugging on the nylon, then the tear can really start to run and get longer. The small run in the stocking is like the damage to our fascia that we get during childbirth. If it's a small amount of damage and we don't strain the tissue further with straining in the bathroom or repeated heavy lifting, it may never get worse. But if we keep on straining that tissue, the tear in the fascia can worsen, and then we can start to have symptoms from it.
Yeah, and the worsening of the fascial tissues and the muscles in the pelvic floor can lead to a whole list of symptoms, which includes rushing to the bathroom and sometimes leaking before we get there. Loss of urine when we cough, laugh, sneeze, run, jump, or exercise. Sagging vaginal walls, which we call prolapse. Feeling loose during sex, or sometimes even pain during sex. Plus, women can feel dryness during intercourse due to all of these changes.
And let's not forget that there can be changes to the external structures, which we collectively call the vulva. Just like the skin on our face and neck shows signs of aging, so does the skin and tissue outside the vagina. We can see wrinkling of the labia, loss of fat and collagen support in the labia, leading to a sagging or a hanging appearance. There can be specific painful areas around the opening of the vagina that result from repairing an episiotomy tear or an incision at the time of delivery. And again, the loss of hormones with age and menopause, most specifically the loss of estrogen and testosterone, result in thinner, shrunken, and tighter tissue that doesn't stretch or flex like it should during sex. In fact, according to ACOG, which is the American Congress of Obstetrics and Gynecologists, 40% of women have psychological distress from female sexual dysfunction, but only 14% consult a physician about sex in their lifetime. So that's a lot of worrying and not a lot of women seeking solutions.
I agree. But the good news is most women are becoming more bold about speaking up about intimate experiences. And we are here to help empower them and not only to start the conversation, but to keep it going to find a solution that women need. And this revolution has been happening for a while now. And I think it's partially because of social media. But as far back as 2006, the American Society of Plastic Surgeons documented a 30% increase in the rate of vaginal rejuvenation procedures. That means women are wanting these services and are willing to search out physicians to help them. But not all plastic surgeons may be willing to dive into the pelvic floor. So what's your opinion? Should women look for vaginal rejuvenation, seek out a plastic surgeon or a gynecologist or someone else?
That's such a good question. And it's actually one that you and I have had lots of discussions about. And it goes back to why I don't like the term vaginal rejuvenation. It's just too broad. I've had women come in and say to me, I'm here to get a vaginal rejuvenation, and I have no idea what they want. When women ask about vaginal rejuvenation, they're typically looking for one of two types of outcomes. One is an external cosmetic procedure that alters the appearance of the vulva, usually involving tightening, shrinking, or improving the appearance of the labia or vaginal lips. The second would be an internal improvement. They want to tighten the feel of the vagina during sex, either for themselves or their partner or both. We call this looseness vaginal laxity, but lots of women think of it as a stretched out vagina. In addition to the internal and external changes, women may also need strengthening of the pelvic floor for a more intense orgasm or for an easier time reaching orgasm in the first place. They may need treatment of urinary incontinence or pelvic organ prolapse. They may need to improve the sensitivity of the vagina. Any one of these things, or all of them together, can be a part of vaginal rejuvenation.
Pain as well can be part of that. Patients who are having vaginal pain with intercourse is also coming in for vaginal rejuvenation as well.
To try to remove that pain, that's true.
Mm-hmm.
So now you can see why I don't like when women come in and just ask for a vaginal rejuvenation. Instead, I want to know, what symptoms do you want to improve? Is it the external appearance? Is it tightening? Is it prolapse repair? Is it treatment for incontinence or pain? We need to go deeper so that each woman gets the result she's looking for.
And this is where we love to dive in and see what's bothering each patient and do a really full exam to see where we can help them improve. Let's start with the external look. If the labia are wrinkled or sagging, it's likely because of the lack of hormone stimulation to the tissue, as well as loss of collagen and elastin as we age, just like every skin in our body. One of the best non-surgical options to tighten the labia and smooth the appearance is microneedling with radiofrequency. Now, microneedling around the opening of the vagina may sound scary, but it's pretty well tolerated if you're numb.
If you're numb.
I should add that up.
We can both attest to that.
Yes. Mm-hmm. All patients receive lidocaine numbing cream to the labia for about 30 minutes. Then the needles will create controlled injuries to the tissue. At the tip of the needles, radiofrequency energy is delivered deep into the tissue to stimulate the growth of collagen and elastin. So this is not an immediate fix to the look of the labia, but we generally recommend one treatment per month for 3 months. Then your tissue continues to grow collagen and elastin for up to another 3 months. That means it's about a 6-month process to improve the labial appearance. Costs will vary based on location, but you can expect to pay about $1,000 per procedure of microneedling.
Right. And now, of course, depending on the result that you want, sometimes surgery becomes an option. Labioplasty is a cosmetic surgery that trims, reduces, or reshapes the labia. Now, while there's no one ideal appearance to the vulva, most people do not want the labia minora, the inner lips, to stick out beyond the labia majora, or the outer lips. This is a surgery done under general anesthesia. It takes about an hour, and there is some special care you need to take and to make sure that the labia heal properly and you get the cosmetic result that you want. Labioplasty surgery costs between $4,000 and $6,000, and surgery obviously will have more risk as compared to microneedling, but you can see the results much more rapidly.
Yes, I have seen patients healing from labioplasty, and it is so important to take good care of the tissue as it heals in order to prevent complications. There can be bleeding, bruising, swelling, and even a hematoma, which is a collection of blood in the labia that may need to be drained. These are all potential side effects of this type of cosmetic surgery. So let's go back to our initial question. Who should perform this type of surgery? Is it the plastic surgeon, the gynecologist, or someone else?
I know. So to be an informed patient and consumer, this is where you have to do your research. Either a plastic surgeon or a gynecologist or a urogynecologic surgeon may all be qualified to perform this type of surgery. But you really want to know how many labioplasties they have performed and what are their outcomes. Many plastic surgeons focus on breast surgery, facial surgery, liposuction, and things like that, but they may not have much experience with genital tissues. Gynecologic surgeons have a ton of experience operating in the vagina, but for many GYNs, it may not be experience in cosmetic gynecologic surgery. So your best path forward here is to really talk to your potential surgeon and don't be afraid to ask their experience in this particular type of surgery. Unfortunately, there's no subspecialty or specific certification that a surgeon can put up on their wall to show that they have skill and proficiency in this area.
Yes, and not many people give their before and after photos for this type of surgeries either.
It's true. Not many people want to see that, but your
Yeah,
surgeon should at least have their own experience on how patients heal and if they've been satisfied with the outcome.
I agree. Yeah, and I think that is the best advice to not be afraid to ask about the experience or to see before and after photos if they have any, and to make sure your surgeon is really understanding what you want the final look of the labia to be.
Exactly. And understanding that surgery may not be the best treatment choice for you. We were just discussing microneedling and radiofrequency for the labia, but we also love microneedling RF for the vagina too, not just for the external structures, but for the internal vaginal canal as well. We almost always combine internal with external microneedling treatment. Internal vaginal microneedling improves the tightness of the vaginal canal, making you feel like your partner fits more snugly during intercourse. Plus, it increases the sensitivity of the vagina. I have so many women who just say they no longer feel anything during penetration. Have you heard that?
Hmm.
Yeah, and this procedure really helps to improve the pleasurable sensation during sex. And while I wouldn't use this as my first line treatment, internal vaginal microneedling can help to improve urinary urgency and loss, that gotta go feeling or leaking just a few drops before you get to the toilet. Finally, microneedling and radiofrequency is one of my favorite procedures to treat lichen sclerosis. This is an autoimmune condition that results in scarring of the vaginal lips together. They can cover the clitoris and shrink the vaginal opening. Now, the typical treatment for this condition is to use a high-dose steroid cream to stop the inflammation. And that's a great first-line treatment to get the condition under control. But the steroid cream does not reduce or remove the scarring, so that's where microneedling comes in. It is such a great non-surgical way to expose the clitoris and make the vaginal opening more comfortable and stretchy so sex can become possible again. So you can see a thorough discussion of what your goals are and how to reach them is really critical.
Do you want to elaborate more on how radiofrequency alone has been used vaginally and in the vulvar tissue as well, and why it's not as great of a treatment?
There is an option for just treating the vaginal canal and even the external structures with the radiofrequency alone. Usually, this is if patients are worried about the needles or worried about the discomfort from the needles. Radiofrequency only treatment will just feel warm inside and outside the vagina, and it can help to stimulate collagen and elastin growth. New collagen growth will help to lift the labia and to give a tighter feel to the vagina. But it really is the combination of the controlled injury from the needles plus the radiofrequency being deposited in those deeper tissues that really gets the results. So even though radiofrequency alone can have some modest effects on vaginal tightening and labial tightening, we just don't see it to the degree that we do with the microneedling plus radiofrequency.
Yes, I agree. And it's also clinician dependent as well, because you have to maintain 42 degrees Celsius in terms of heat, and you have to keep moving. And depending on how long you treat the area, it can have an effect. So I think it's minimal effect of it, but it works for some patients who just needs a little bit of rejuvenation.
Exactly.
But let's move on to some other non-surgical treatments that can help to improve vaginal dryness and pain during sex. Before I begin with any procedure to improve vaginal dryness, I always recommend that patients start with vaginal estrogen cream. There really is no patient who is not a candidate for this, because vaginal estrogen cream is local therapy. That means it just stays in the area of the vagina and bladder and does not travel systemically or throughout the body. It improves blood flow to the tissue, It improves the thickness and stretchiness of the tissue, and this is the basis of improving vaginal dryness and pain with sex. The vagina is meant to have estrogen. Vaginal estrogen takes a full 12 weeks to improve vaginal and bladder health, but patients usually start to see results in 6 to 8.
And please check out our many other podcasts where we go much more deeply into medical treatments for vaginal dryness and more of the medical data on vaginal estrogen. We spend a ton of time giving you all the info on options, side effects, cost, and how to pick the right product for you.
Yes, but once vaginal estrogen has done its job, sometimes women do not get enough relief from estrogen alone. That's where vaginal laser comes into play. The two most popular are a fractionated CO2 laser, which uses a 10,600 nanometer wavelength, and erbium YAG laser, which uses a 2940 nanometer wavelength.
The fractionated CO2 laser is an ablative laser, which means it is ablating or evaporating tiny columns of the surface lining of the vagina, which induces healing around those areas. Then new collagen and elastin fibers are formed, which improves vaginal moisture, hydration, and elasticity. It's indicated for postmenopausal women with genitourinary syndrome of menopause, GSM, which is the new medical term for vaginal atrophy or dryness. Histologic results 1 month after vaginal treatments with CO2 laser show thickening of the epithelium, which is the surface of the tissue, lengthening of the papilla, which are the folds or the ridges in the tissue, increased glycogen storage, which relates to increased tissue hydration, and improved fibroblast activity, which is what will result in new collagen and elastin production. Many of the studies for vaginal CO2 lasers are prospective observational studies, which show improvement in the quality of life and vaginal atrophy symptoms. And adverse events were minimal and transient.
Yes, and you can see some temporary spotting or bleeding for a few days after an ablative laser treatment, or have some burning and irritation for a few days, but overall it is an amazingly safe laser. The erbium YAG laser is non-ablative type, which means it will not evaporate tissue. Instead, it drives columns of heat deep into the tissue layers of the vagina beyond just the surface, again stimulating these deeper layers to increase the production of collagen and new blood vessels, which is called angiogenesis. It is indicated for postmenopausal women with GSM, and is also marketed for premenopausal women with vaginal laxity. One study of 205 women followed them up for up to 24 months after vaginal treatment with erbium YAG and found significant improvement in vaginal dryness and painful intercourse for up to 12 months after treatment, but a decline in clinical improvement at that point.
So the best laser treatment for vaginal dryness may be to combine both the ablative wavelength with the non-ablative wavelength. So we're treating both superficial and deep layers of the vagina in one shot. There's only one laser that does this. It's the Diva laser from Cyton, and it combines both wavelengths into one quick treatment. After we place some lidocaine numbing gel into the vagina, the laser is passed several times, and both the non-ablative and ablative treatments are happening simultaneously. The whole treatment just takes about 5 minutes. Just like vaginal microneedling, we recommend 1 monthly treatment for 3 months, with collagen and elastin continuing to improve for an additional 3 months after that. And the cost is about $1,000 per treatment.
So we have discussed non-surgical treatments to treat the appearance of the labia and to help tighten the vagina, as well as surgical options for the labia. But what surgical options do patients have for the inside of the vagina?
Again, this is going to depend on what your starting anatomy is and what your goals are. If prolapse is present and you're looking for a surgical repair, vaginal reconstruction is a great way to go. This is a surgery that repairs the weakness in each wall of the vagina, replacing it back where it should be. These surgeries last from an hour to an hour and a half, and the recovery is about 6 to 8 weeks at home with no heavy lifting, no exercise, and no sex during that time. Any vaginal reconstruction surgery, even in the best hands, does have the risk of prolapse returning, and the rate of recurrence runs about 10 to 12%.
And we have an entire podcast that goes into all the options for treating prolapse, both surgical and non-surgical. So if listeners are interested in that, they should check that out. It's quite detailed.
Yes. And then there are some patients without prolapse who still want some tightening performed surgically. This might be called a vaginoplasty or a perineoplasty. You can think of it as a reverse episiotomy. The opening of the vagina is incised, and the edges of the muscle that are supposed to hold it together are overlapped and sewn together more tightly. This makes the opening of the vagina and the lower part of the vaginal canal more narrow so that the vagina feels tighter during sex. If no prolapse has to be repaired, this type of surgery may have a little shorter recovery, maybe just 4 to 6 weeks of no heavy lifting, no exercise, and no intercourse. In either surgery, you're just going to have layers upon layers of sutures in the vagina, so you really want to make sure they fully heal before you put anything in there.
Yes, you don't want anything tearing up all that work you've done at surgery.
Right.
Can you over tighten somebody?
You can, and this again goes back to the skill of your surgeon and making sure you're talking to your surgeon. I do quite a number of these procedures because very often I am doing a vaginal tightening procedure at the same time I am repairing someone's pelvic organ prolapse. They very often have to occur together. And so I know how tight a normal, undamaged vagina should be. If you make the vagina too tight, you can actually create pain during intercourse. In the worst case scenario, patients would not even be able to have penetration at all.
I only bring that up because I did have an actual patient and it was not yours.
Thank you. Thank you for pointing that out.
Yes, it was not yours. It was post-vaginal delivery.
And she was over-tightened with her repair?
Yes, and she had severe pain after intercourse, or with intercourse. But one thing that surgery could not do is to make the muscles of the pelvic floor stronger. The pelvic floor is a shelf of muscle and ligaments that stretch from side to side and front to back. They hold up organs like the bladder, the vagina, and the rectum, and they're the most important muscles that contract during an orgasm. So if you're able to have an orgasm, but you feel the intensity or strength that orgasm has kind of diminished, then thickening and straightening these muscles can help. We've discussed on the podcast before that the best therapy for these muscles is the Emsella chair, which this chair will focus electromagnetic energy directly into the muscles, which creates thousands of full pelvic floor contractions in just one session. It is painless and it's easy to do, and we can actually measure the strength and lift of the muscle on MRI. No other therapy can get that kind of result.
Emsella is great for patients who can already reach orgasm easily, but many women actually struggle to get there at all. Sometimes the vaginal anatomy is fine, but the nerves that help women orgasm need a boost. They've just subsided or dulled with age, so stimulation that once could bring you to orgasm just doesn't work anymore. PRP, or platelet-rich plasma injections into the vaginal wall, the clitoris, and the labia, can help to increase cell growth and increase nerve growth in this area to make orgasms easier to achieve in the first place. Both Emsella and PRP injections for orgasm are also a part of vaginal rejuvenation, and they can be done alone or in conjunction with any of the other procedures and surgeries we've discussed today. In fact, if I do a prolapse surgical repair, I recommend across the board that once people have healed, that they go through a course of pelvic floor strengthening with the Emsella chair to help protect their prolapse repair and reduce the chance that the prolapse will come back.
So bottom line, vaginal rejuvenation is really a catch-all term. So many services, procedures, and maybe surgeries that help to address vaginal dryness, vaginal looseness, prolapse, incontinence, and difficulty with orgasm. But we should just change the word.
Yes. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.